Types and differences of diabetes. There are a few types of diabetes. Researchers are as yet characterizing and sorting a portion of these varieties and setting up their predominance in the populace. Kinds of diabetes include type 1 diabetes. An immune system ailment wherein the insusceptible framework erroneously crushes the insulin production beta cells of the pancreas. It regularly grows more rapidly than different types of diabetes. It is generally analyzed in kids and youths, and here and there in youthful grown-ups. To endure, patients must regulate insulin drug regularly. Type 1 diabetes used to be called adolescent diabetes and insulin-subordinate diabetes mellitus (IDDM). In any case, those terms are not precise in light of the fact that youngsters can create different types of diabetes, grown-ups now and then create type 1, and different types of diabetes can require insulin therapy. A variety of type 1 that grows sometime down the road, for the most part after age 30, is called dormant immune system diabetes of adulthood (LADA). Some of the time patients with immune system diabetes create insulin obstruction due to weight gain or hereditary variables. This condition is known as twofold diabetes. Type 2 diabetes. A turmoil of digestion, normally including abundance weight and insulin obstruction. In these patients, the pancreas makes insulin at first, yet the body experiences difficulty utilizing this glucose-controlling hormone. In the long run, the pancreas can't create enough insulin to react to the body's requirement for it. Type 2 diabetes is by a wide margin the most well-known type of diabetes, representing 85 to 95% of cases in created countries and a significantly higher rate in creating countries, as indicated by the International Diabetes Federation. This ailment may take years or decades to create. It is generally gone before by prediabetes, in which levels of glucose are better than average, however not sufficiently high yet for a finding of diabetes. Individuals with prediabetes can regularly defer or forestall the heightening to type 2 diabetes by getting thinner through enhancements in exercise and diet, as the Diabetes Prevention Program and other research ventures have illustrated. Type 2 diabetes used to be called grown-up beginning diabetes and non-insulin subordinate diabetes mellitus (NIDDM). Those terms are not exact on the grounds that youngsters can likewise build up this infection, and a few patients require insulin treatment.